Welcome to Native America Calling. I'm Sean Spruce. Have you gotten a COVID booster shot? Depending on who and where you are, you may have more difficulty than usual getting the vaccine for the highly contagious disease. That's because the federal government changed the guidelines for who is eligible. The shift in direction is causing confusion in some places, just as COVID cases are picking up steam. We'll sort out questions about COVID vaccines coming up after the news.
This is National Native News. I'm Antonia Gonzalez. During World War II, at least 100,000 Japanese Americans were forced into so-called internment camps across the U.S. Seen by the government as a potential threat within America's borders, memories of the mass incarceration still burns hot for former prisoners and their families. Senior reporter Brian Bull of Buffalo's Fire reports on a Native American college that held a special dedication to preserve that history.
About 200 people gathered at the Snow Country Prison Japanese American Memorial last week at the United Tribes Technical College in Bismarck. taiko and native drummers performed together as dignitaries honored the 1,850 Japanese men who were confined here back when the site was known as Fort Lincoln. Satsuki Ina was born in a California internment camp in 1944, and her father, Itaru, was kept at Fort Lincoln in 1945 through 1946. Her book, The Poet and the Silk Girl, is a memoir based on her parents' letters, diaries, and her father's haiku. The memorial is the culmination of 25 years that Ina and the UTTC worked together to preserve this history.
There were trees that the Japanese American prisoners had planted, and there was this story that there were ghosts that wandered around, and that when the wind blew on these trees, it sounded like somebody was crying. So there was actually a healer that would come every once in a while and bless those trees. So when I heard stories like that, I felt like the memory of their presence was really being protected and honored.
Ina says there are efforts by the Trump administration to erase or dismiss past atrocities against communities of color. So she sees the UTTC's support, including giving some of its property to the memorial, as key to keeping history accurate and the government accountable.
This is, in many ways, an act of solidarity with the Native people and the Japanese Americans. And the lesson is, it's in our collaboration, our solidarity with each other, that we strengthen our truths and stand in opposition to efforts to erase our history, to alter it, to rewrite our narratives in ways that don't talk about the truth.
At the end of the dedication ceremony, a Japanese and native flute player performed together as visitors placed paper crayons on the names of those incarcerated at Fort Lincoln. These were inscribed on slate tiles that once lined the barracks. For National Native News, I'm Brian Bull in Bismarck.
Over the summer at the University of South Dakota, 20 high school students attended the annual Oscar Howe Summer Art Institute, learning from each other and renowned Native American artists. The camp's inspired by artist Oscar Howe, who paved the way for Native artists to challenge stereotypes, teaching at the university for more than 2 decades. Instructor Keith Braveheart helped students learn about Howe's approach to art, recounting his first experience with the Trailblazers' legacy.
It felt like the work was alive, like it was physically breathing, like it was pulsating. And I know that it could have been an optical illusion because of the way that he designs his work, but I also later would truly believe that it was imbued with a Dakota spirit.
Braveheart studied in one of the Institute's many iterations as a student.
I see this potential that what was my path, my journey, what that could be like, might be similar to a next generation of an artist, a younger artist.
A citizen of the Oglala Sioux tribe, Braveheart says he thinks creating those future pathways is what Oscar Howe envisioned. I'm Antonia Gonzalez.
National Native News is produced by Koahnic Broadcast Corporation with funding by the Corporation for Public Broadcasting.
Support by Sonosky Chambers Law, championing tribal sovereignty and Native American rights since 1976. From opioids litigation to treaty rights to tribal self-governance. With offices in Washington, D.C., New Mexico, California, and Alaska. Sonosky Chambers Law.
Support by AARP. AARP creates and connects people to unique tools and programs, helps conserve personal resources, and tackles issues that matter most to individuals, families, and communities. More at aarp.org.
Native Voice One, the Native American Radio Network.
This is Native America Calling. I'm Sean Spruce. Just as coronavirus infections are on the rise, federal authorities offer confusing recommendations about vaccinations. Many people are now wondering whether they are eligible for a COVID shot, where to get one, and whether it's covered by insurance. The answer could depend on whether your state or tribe is filling in gaps following an abrupt change from the Federal Food and Drug Administration over who should get the shot. This about-face on vaccines is drawing criticism and even defiance by established medical groups. A growing number of states are making policy changes that allow healthcare facilities and pharmacies to continue to offer the COVID vaccine to more people than federal agencies recommend. We're going to hear about two different examples today that shed light on how COVID vaccinations might work going forward. You can join us. Call 1-800-996-2848. Ask a question, share a comment, share an insight. That number is also 1-800-99-NATIVE. Joining us now from Tahlequah, Oklahoma is Dr. Beth Harp. She is the Executive Medical Director for Cherokee Nation Health Services. She is a citizen of Cherokee Nation. Dr. Harp, hello, and welcome to Native America Calling.
Hello, welcome. Glad to be here. Excited for our conversation today.
Absolutely. Joining us from Santa Fe, New Mexico is Janet Johnson. She is the Tribal Liaison for the New Mexico Department of Health. She is from Nambay and Santa Clara Pueblos, and she's also Mandan and Hidatsa. Janet, hello to you as well. Welcome to our show.
Biakinji, Sangitamu. Good morning, everyone. Thank you for this opportunity.
Sangitamo to you as well. Joining us also in Santa Fe is Dr. Miranda Durham. She is the Chief Medical Officer for the New Mexico Department of Health. Dr. Durham, pleasure to have you on the show today. Welcome.
Thank you so much. We're really pleased to be here.
I'm pleased to have all of you on the show today. And Dr. Harp, I'd like to begin with you. And if you could help our listeners understand what has changed with regard to federal health care policy and the COVID vaccine. Give us an overview, if you will.
So if you've been following the news, in addition to some of the concerns with cuts and funding for certain vaccination types and grants tied to lots of things in addition to COVID, the biggest change would be the CDC recommending an FDA taking away the recommendation for the COVID vaccine for essentially healthy patients 65 and younger was the big change. Not really. There are some criteria, some comorbidities that they list, but for healthy children, including pregnant females and adults that are healthy, the broader recommendation for the immunization was excluded from the routine recommendations this year. The emergency use authorization from years past was rescinded, which allowed for ease and a little bit more clarity for our healthcare providers when they were making a decision on immunization with their patients. As we've also seen, there's been some larger leading medical groups, including the American Academy of Pediatrics and American College of Gynecology, that did, essentially come out and make their own recommendation, which further contributes to supporting our physicians, of course, but also some, further confusion and just honestly patient mistrust and community mistrust and what are they supposed to do? And kind of, obviously for a long time. There's been some mistrust with federal government and Native American tribes for good reason. And this kind of drives that wedge a little bit more, I'm afraid, and kind of takes back a little bit of the progress that we've made in our own reservation over the past decade or so. So essentially, the guidance limiting the COVID-19 vaccine recommendations to primarily people over the age of 65 and with those underlying health condition patients was the biggest impact that we're seeing and with policy change.
All right. Thank you, Dr. Harp. Now, some people might need to get a prescription from their doctor for the COVID vaccine. Can you walk us through how that might potentially work?
So yeah, there are every health system may operate a little bit differently. Within our own health system, we function a lot with standing orders, which allows for a lot of our immunizations to be given through things like our drive-through clinics and some of the outreach that we do in community events. So the biggest thing for us is going to be that shared decision-making is really written out in the CDC's recommendations as far as patients that don't meet those criteria. And I think that's also leading to some of the confusion about, how do we get that? Well, now that's going to require potentially an office visit with a physician, unless you come up with a way to bypass that, which we actively look at, right? And you've seen some of the states on the West Coast looking at how they can form these coalitions for these independent recommendations to make sure that access continues. But yeah, essentially patients now potentially could need an office visit with a physician or advanced practice provider to allow them to get a prescription for a vaccine that otherwise they may have just presented at a pharmacy and were able to get. Obviously, there's a cost incurred by that patient. Fortunately, within our health system, we are able to provide that at no cost to patients. However, our system does incur a cost. And one of the things that our health system has been very prudent about is making sure that we are very good stewards of not only tribal dollars that we get, but also federal dollars and grant monies and things like that. So yeah, patients are looking at most likely, if they don't fall into that criteria, needing an office visit for essentially a prescription for a immunization. And so there's the cost there. There's a cost at pharmacy. The guidelines everything's evolving, right? Our Blue Cross Blue Shield, we've reached out to a lot of our payers. There's a lot of uncertainty there. Are they going to pay for the immunization if the patient doesn't meet the FDA requirements and thus off-label use? Are they going to be covering that? So there's a lot of just up in the air as far as how patients are going to not only get, the cost of the physician's visit, but then also the additional cost of the actual vaccine when they get the vaccine administered too.
All right. Dr. Harp, lots of really good information here. Let's go ahead now and narrow this focus down to a more local level and talk about what's happening there with regard to Cherokee Nation. Let's say right now a Cherokee Nation citizen wants to get the COVID vaccine today. How do they do that? Where do they go, Dr. Harp?
So currently, our source for our immunization hasn't offered those for us to order, but that we expect it by the end of the week that we will not only order but begin acquiring our COVID vaccine in stock. So currently, the medical staff is really on the page of, does the patient want to have the immunization? If they do, if there's not any contraindications to a patient getting the medication, our medical staff is very much in support of immunizing patients for COVID-19 specifically. We're very pro-friendly to all vaccines, but with respect to the conversation today, COVID vaccine is going to be something that I anticipate our medical staff not only administering but promoting. I think if you look at Indian country, not very long ago, we were seeing communities absolutely devastated by COVID-19. Our medical staff, our hospitalist staff, our clinic staff, our emergency department, if you ask them to think about what those days were like taking care of patients, in the hospital dying, left with comorbid, long-lasting COVID impact conditions. It's very much, it's not something we like to think about. It was very traumatic for the medical staff and our community, but it is something that we don't forget. And lessons were learned there. And one of those lessons was that, if we can impact a family member, a community, an employee with allowing us to offer an immunization based off science and research, then we absolutely are going to support that. It is just something we're going to do.
Dr. Harp, the Cherokee Nation COVID vaccine policies that you just described, are those different than what applies to the rest of the state of Oklahoma?
I'm certain. We are in a fortunate situation where, our payers, our patients, our citizens that come into our clinics, and non-beneficiaries. We offer COVID vaccines to patients that are not members of our staff that are of our community that are eligible for services. So we have traditionally, since COVID vaccine was produced, we've offered it to community members, non-tribal members. That's something we fully plan to do. Again, we are fortunate in that we are, the patients don't have a cost, right? So that's easy for us. If I work at an outside facility that's non-tribal that doesn't have the ability to make some changes within, and they're looking at, which, by the way, rural hospitals and clinics in Oklahoma, have been hit hard by certain changes. And so when you start talking about how that cost is going to incur and how much cost of living is, and in the state of Oklahoma, if you are living in a rural community and you are living at poverty or lower socioeconomic status patients, that health disparity is already there. So when you throw this on top of it, and a patient is struggling to figure out how they or their family are going to get, number one, a new office visit if they don't have a payer, right? And then two, how are they going to get this immunization covered? So we certainly are functioning. Fortunately, Chief Hoskin, Deputy Chief Warner, the Tribal Council have been incredibly supportive of everything that we've done and support science, support immunizations. We've got a very robust public health service that's also in line with us. So while it's much different on the outside world, Cherokee Nation has been and will continue to be an advocate and a partner with our community, not just our beneficiaries.
All right, short break, and we will be right back. Two film projects, one a big-budget Hollywood drama and the other an independently produced documentary, bring historical Native themes to audiences. We'll hear about Jason Momoa's Hawaiian epic Chief of War and the Alaska true crime Hulu series Blood and Myth on the next Native America Calling.
My name is Tammy, and I'm a member of the Little Traverse Bay Band of Odawa Indians. Smoking gave me heart disease. I used to think of cigarette smoking as something that only affected me. Then at just 44 years old, I had to look into my mom's eyes on the way into emergency heart surgery and tell her, "Mommy, I promise I won't make you bury me." My tip is, think about the people in your life who love you. They go through the pain too, maybe even more than you do.
The people you love are worth quitting for. You can quit. For free help, call 1-800-QUIT-NOW. A message from the CDC.
We're glad you're listening today to Native America Calling. We were talking about changes to COVID vaccine eligibility by the Trump administration. The Federal Food and Drug Administration approves the shot for those 65 and older and people with certain pre-existing health issues. That means millions of others will have a more difficult time getting the vaccine depending on where you live. Is this a concern for you? Let us know. The number is 1-800-996-2848. That's also 1-800-99-NATIVE. We have Dr. Beth Harp on the line in Tahlequah, Oklahoma. She is the Executive Medical Director for Cherokee Nation Health Services. And Dr. Harp, these new federal COVID vaccine policies, are you expecting a rise in COVID patients at your health facilities this fall and winter because of them?
So certainly, as you know, the nature of a virus and virology is, the typically viruses just continue to become more contagious as with time, and we've seen that over the past few years. Certainly increased cases. At different times of the year, we'll see pockets of just outbreaks of these kind of things. But absolutely, immunization, not with just COVID, but with any pathogen. Obviously, you see a direct correlation with vaccine rates and cases. So we expect it to be no different. We fully expect to see more cases, and are committed to continuing to test and offer any kind of treatment and follow up to those patients. But for sure, we are expecting that, unfortunately.
What kind of questions and concerns are you hearing from patients there at your facilities?
Right now, there are a lot of patients that are just honestly anxiously waiting to hear about when they can get the immunization. We've had parents talk with our pediatricians about when they can expect to get it. And so right now, the impact that not really the impact, but the questions and calls that we get primarily are we going to be able to get this immunization here, and when can we get it? And so really it's just a lot of proactive parents right now that are ready and engaged. We've got, what I feel like are some of the best board certified pediatricians in the nation that work with us and have done a great job of really talking to patients, talking to their families, talking to parents, and really closing that gap on, vaccine miscommunications and misunderstanding, and really doing the grassroots efforts that are needed to help educate our parents and our families and communities on what their recommendations are and vaccine safety and all of those things. So that's the big part now. Is I think they've done an excellent job of being proactive on visits prior. All those well child visits are paying off, and so they're starting to build those questions about that. But they certainly are very united on American Academy of Pediatric recommendations, and if you look at the numbers of immunizations or vaccine drive-through events, I think it reflects a lot of clinical shared decision making over the past few years, and the proactiveness of our health team and our public health team to really educate the community about vaccine safety and the need, right? So we've seen almost a double in the combined immunizations that we've done at our drive-through events from 2023 to 2024, where our amazing nurse team gave over 6,000 immunizations combined of flu and COVID during those 2 weeks. And so what we've seen is just a really a positive response by the community. We know it can be greater, and we certainly know that this contributes to some confusion and some mistrust, but we are doing everything that we can to try to battle that through, a lot of it shared decision making and conversations with parents in the room.
All right. Thank you, Dr. Harp. 1-800-99-NATIVE. If you have questions about the COVID vaccine, if you live in a state and you're not quite sure whether or not you will have access to the vaccine this fall and you're concerned, give us a call, 1-800-99-NATIVE. We have folks on the show today who can help answer your questions or at least steer you in the right direction. And I also want to let you know we reached out to the U.S. Health and Human Services Department when producing this show. They didn't make anyone available for our show today, but they did send a written response, and you can read the entire statement on our website. Here is an excerpt. Under the leadership of Secretary Kennedy, HHS is returning focus to the doctor-patient relationship. The department encourages individuals to talk with their healthcare provider about any personal medical decision, including vaccines. To be clear, HHS is not limiting vaccines. The COVID-19 vaccine remains available to anyone who chooses it in consultation with their healthcare provider. We have the full statement on our website, nativeamericacalling.com. If you'd like to read it all, go ahead and check out our website, nativeamericacalling.com. NAC producer Andy Murphy spoke to Dean Seneca about this issue we're talking about today. Dean is the CEO of Seneca Scientific Solutions Plus, and he's also an adjunct professor at the School of Public Health and Health Professions at the University of Buffalo in New York. Dean Seneca is a frequent guest on Native America Calling, couldn't make today's show, but let's go ahead and listen to an excerpt of this interview that Andy Murphy had with Dean Seneca yesterday.
The administration picked someone to lead the department who's an anti-vaxxer. Their methods for anti-vaccination are really not based on good science at all. I don't believe RFK is acting in good faith. You know, his record is riddled with contradictions and falsehoods. His tactics often erode trust under the guise of restoring trust and building trust. You know, treating him as a serious partner would be a major mistake for our tribal nations. I would not trust him. For us in public health, that's deeply frustrating. It basically signaled the burden of medical decisions making is entirely on the individual. It tells people, diagnose yourself. You know, I'm a trained public health professional and it takes me forever to look up and decide, you know, what is good science or to debunk everything that's coming out from these anti-vaxxers. You know, we need to be able to rely on our medical community, our public health experts to interpret good science. And we are going in the wrong direction under this guy's leadership.
How do you see limiting access to vaccines affecting Native people in the future and down the road?
You know, we're very susceptible to a lot of illnesses, right? And if we have pre-existing conditions, it only hurts us more if we don't get vaccinated. So if we have pre-existing conditions like, you know, cancers or diabetes, for natives not being vaccinated because we are an at-risk population, because we have a lot of pre-existing conditions, it could easily lead to people being very, very, very sick and or death. And we have seen it in our populations. I mean, we did not do good as Native people and Native populations regarding COVID-19. I mean, it wiped out some parts of our communities. But it really is coming down right now to states. If you're in a blue state, you're pretty much in good hands. You know, you're going to have access to vaccines. But if you're in a red state, you're really going to be limited. You're going to have to get literally a prescription if you're a pregnant woman to get a vaccine. If you're the spouse of that woman, you might have to get a prescription as well from your doctor to get it.
You and your partner are expecting, and you guys are having trouble accessing the COVID vaccine.
So we're very blessed, and we're both very, very happy that we are pregnant with child, and we made a decision that we wanted to get vaccinated. In the very beginning, before legislation came down from New York State saying that they're going to allow and vaccinate everybody, we were very concerned because we were hearing stories of other families and couples that were trying to get vaccinated in other parts of the country. And basically, the woman with the child was denied, and so was her partner from getting the vaccine. Because we're in a blue state, we're able to get a vaccine, and we're very happy about it. Actually, we're going to go on Friday. But the decision by, Kennedy to put kids, pregnant moms, and their babies at risk of unnecessary suffering that is preventable. They're doing things that are counterintuitive and not supported by the scientific community.
Who do you think we can look up to now in the scientific community if you are not trusting the HHS and this administration?
I would say that American Medical Association is a very strong partner that we can look up to, the World Health Organization, the American Public Health Association, Association of State and Territorial Health Officials. There's the National Association of City and County Health Officials. But there are some really good organizations out there that, support health. I would even throw out there, our National Indian Health Board, the Association of American Indian Physicians, my company, Seneca Scientific Solutions Plus. We're always putting things on our website for good health and wellness in Indian country.
That was Dean Seneca, CEO of Seneca Scientific Solutions Plus, weighing in on his concerns and his perspectives with regard to federal healthcare policy on the COVID vaccine. And phone lines are open for anyone who would like to join this conversation. If you have a question, if you have a comment, 1-800-996-2848. That is the number, 1-800-996-2848. Share your thoughts, share your insights on the air. Let's now move to New Mexico and get another local perspective on what's happening with regard to COVID vaccinations and COVID cases. And Dr. Miranda Durham is the Chief Medical Officer for the New Mexico Department of Health. She joins us now from Santa Fe. And Dr. Durham, can you give us an update on current COVID cases in New Mexico? Are they rising? Are they staying about steady? What do you see, and what do you see coming up in the weeks and months ahead?
Yeah, good morning. In New Mexico, we are seeing a small uptick in cases of COVID cases in New Mexico. It's always hard to predict where we're going to go with that, and it's certainly nothing like we saw last winter.
Now, New Mexico was actually one of the first states to take action and respond to the government removing COVID vaccine off its list. What did policymakers do to maintain COVID vaccine access?
Yeah, we have been busy in New Mexico making sure that we have access to COVID vaccine. So I think one of our biggest hurdles was that the national chain pharmacies, after the FDA ruled that, the FDA approved the vaccine just for 65 and over and 2 through 64 with underlying conditions. The issue was that we didn't have those ACIP guidelines. We just had the FDA approval. And in New Mexico, pharmacists can give the vaccine, but it's always been tied to the ACIP guidelines. So what we did is rewrite that vaccine protocol for pharmacists and allowed them to look at wider guidance than just ACIP. So now they can reference the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and even the Department of Health. So we in the Department of Health put together guidelines for COVID vaccine. We used essentially last year's guidance that everyone 6 months and up should receive the updated COVID vaccine. And we put out that guidance, and that got our pharmacists across the state able to give vaccine again. And then just yesterday, we issued a standing order. There's been lots of talk. There are, some situations where you still need a prescription, and this essentially provides a prescription to anyone in the state who needs a prescription for COVID vaccine and otherwise qualifies for a COVID vaccine.
Now, those organizations that you just mentioned, is that where the state of New Mexico is looking for guidance? Because we just heard from Dean Seneca, the recorded interview, that a lot of folks right now are very distrustful of the CDC and the FDA with regard to these policies that are coming down from the federal level.
Yeah, I think certainly providers have always had that, their professional organizations that they look to for guidance. And so again, the American Academy of Pediatrics issued broad guidance on COVID vaccine, really supporting, one of the highest risk groups for COVID is that under 6 months old before kids are, they're too young to be vaccinated. And kind of the next big risk group is 6 months to 2 years old. So the American Academy of Pediatrics, they're a science-based organization and issued broad guidance supporting COVID vaccine for all children. The American Academy of Family Physicians just issued guidance a couple days ago, kind of more on the adult side. So, yeah, I think people are looking to, looking broadly for scientific-based guidance.
All right. And Dr. Durham, for somebody who's listening to the show right now, and maybe they're under the ages, let's say they're 35 years old, they're in good health, they don't have pre-existing conditions, and they're just wondering, gee, should I get the COVID vaccine this year? Maybe they didn't get it last year or the year before. I talked to a lot of people who stopped getting the booster shots quite a while ago. What's your recommendation for a person like that?
Yeah, I think as Dr. Harp was saying, there is always, that shared decision making is, I don't want to give just a blanket, everyone should get it, but I think if you do look at who's at risk for bad outcomes from COVID, on that list is people who haven't been vaccinated, and certainly people who have maybe skip that booster for a couple of years are likely to be more at risk. Of course, some of this depends on, what does your day-to-day look like? If you're a teacher in a classroom and, we all know what teachers put up with in terms of lots of, runny noses and viruses, that's someone I would say should go ahead and get vaccinated. Maybe if you lead a life where you don't interact with a lot of people, it's not as important for you. But there's just no, this is a vaccine that has been shown to be safe and effective. And so I really don't see a downside to just going and getting vaccinated.
1-800-996-2848. That is the number to our Albuquerque studio. If you would like to ask a question or share an insight, what are your thoughts with regard to the COVID vaccine? Here it is, fall 2025. More than 5 years since the COVID-19 pandemic just ripped across the world and impacted so many countries. And of course, here in the United States, many tribal communities were hit very, very hard. 1-800-99-NATIVE. That is the number to join our discussion today. And stay with us. We'll be right back.
The annual 2025 Indian Nations Conservation Alliance National Conference happens October 14th in Las Vegas. This 3-day gathering of tribal leaders, professionals, youth, and community members unites voices and action around conservation, innovation, and indigenous stewardship of Indian lands and resources. The Indian National Finals Rodeo will be there too. Info and registration at inca-tcd.org. Inca supports this show.
This is Native America Calling. We are talking with public health specialists today about vaccine access. And there's still plenty of time if you would like to join our discussion today with your comments and questions. The number to call is 1-800-996-2848. That's also 1-800-99-NATIVE. Our next guest, Janet Johnson, is also in Santa Fe, New Mexico. She is the tribal liaison for the New Mexico Department of Health. And Janet, welcome and hello again. Thank you for joining the show. Now, we just heard from your colleague, Dr. Durham, with a general overview of what is happening with regard to COVID there across the state of New Mexico. Let's focus in now more on Native communities and Native people. Can you tell us what considerations that the state is making regarding COVID vaccines and Native residents? And I'm thinking of people both living on reservations and off reservations in New Mexico.
All right. Good morning again. And I thank you for this opportunity to speak on this. And as was mentioned earlier by Mr. Seneca, when we look at having vaccines available to our tribal populations, we need to be considerate of some of the health disparities and the challenges that go along with that. That might be a more rural location and not as much access to the vaccine. But what we've seen and what we've done in the past during the pandemic and continuing afterwards is leveraging our resources. And that includes our mobile vaccine clinics from Department of Health. And when we look at that, we have had a very strong response from our tribes, our tribal serving organizations, and our tribal higher ed facilities. So for New Mexico, we have 24 tribes, pueblos, and nations. Of that, and this is just for this past year, we have had 11 different tribes, pueblos, and nations reach out and work with our mobile vaccine unit, and we have been able to provide service at 17 different events. We have had 2 urban tribal serving organizations and host 2 different clinics. We're looking at scheduling a third for tomorrow. I need to receive confirmation, but when we look at this, especially when we look at our urban population, we see more challenges. Some may not be able to receive benefits from IHS or an hospital, maybe because of insurance issues, but we have our mobile vaccines available, and we are able to help support our urban Indian organizations. We've also have had our tribal higher ed programs reach out, and we have hosted at 2 different locations for 7 events. So we're looking at covering not only our student populations, but also our administration.
Let's talk more about the Indian Health Service. Now, earlier we shared a statement from HHS regarding their policies in regard to accessibility of the COVID-19 vaccine, but I'm interested to know how closely you folks there at the state level work with the Indian Health Service and various clinics and hospitals in the state, and even 638 contracted healthcare facilities that might still get IHS funding. How closely do you work with those clinics and those providers to make sure that access to the COVID vaccine is available?
All right, and thank you for the question. Again, when we look back to the pandemic, we had a shared response. So if a tribe had requested a vaccine clinic and IHS was a partner to provide vaccines to the tribal employees, the tribal populations, we would also be invited to attend to provide vaccinations to the non-beneficiaries and other community members that may not have that same access. So we have continued to work with IHS, the 638s, in what they may need to help supplement and provide the best resources, ensuring the health, wellness, and safety of our tribal populations.
And what do they tell you they need? What are the resources? What are the skill sets? What are the personnel, perhaps, that they request?
That is a big consideration. So each tribe is different in terms of needs. The 638s, again, are operated by the tribes and best able to respond to what are their priorities, and we take their direction and honor tribal sovereignty and autonomy in determining what are their best priorities. So that could be, again, providing the mobile vaccine units for the administration of vaccines. It could also be working with our tribal epidemiology centers and the promotion of health education materials. So if you're familiar with the Albuquerque Area Southwest Tribal Epidemiology Center, throughout the pandemic and continuing with other areas, whether it's flu or measles, they've developed culturally appropriate materials, health education materials, and that can be shared with our tribal community health representatives, community health workers, as they go out and speak with the people and provide them information on the benefits of vaccines.
Janet, what kind of feedback are you getting? And I'm thinking of tribal health officials there in Pueblo villages, on the Navajo reservation, on one of the Apache reservations, perhaps. What are they telling you about this whole new approach, this pivot here from the federal government with regard to vaccination policy?
So as we look at this, again, this is a very large concept, and depending on the population and the availability of capacity, it is a varied response. Again, we do work closely with the tribal leadership and with senior leadership with Indian Health Service to ensure our responsiveness and our responsibility in being able to support them. You know, there are challenges when we look at some of these actions being taken, but how best can we look at leveraging all the different resources? The staff are committed and dedicated throughout the state in ensuring the protection of tribal populations. We've seen during COVID the incredible response from tribal leadership, ensuring the health and safety of their members by taking actions such as closing their tribes in efforts to minimize spread. So as we continue to have these dialogues, you know, what can we do to help support?
All right. Janet, I want to go back to Dr. Durham for another question, but before I do that, these mobile vaccine projects, these clinics, these outreach events, listeners might be really interested in knowing where they can get more information about those.
All right. Well, we have our New Mexico Department of Health dashboard. You know, for more information, if you want more specific information, you can contact me and I can put you in touch with our mobile vaccine team. They do have a form. Unfortunately, I don't have that link to the form right now, where you can explore and be able to navigate scheduling a mobile vaccine clinic. So maybe you're working at one of the pueblos in the public health office and you want to schedule a mobile vaccine clinic for your community, you know, you would be able to do that. We also have our NMDOH helpline. They would be able to direct you to the mobile vaccine.
All right. Thank you, Janet, very much. Appreciate it. We still got time here. If somebody would like to join the conversation, 1-800-996-2848. We can get another call in here if you get on that phone right now and don't delay any longer. 1-800-99-NATIVE. Dr. Durham, back to you. And I want to go back here and just talk a little bit more about the confusion that we're seeing here at the federal level with regard to this vaccine policy. And again, it comes down to confidence. And it's just so important that people have confidence in the medical community, right? We need to have that confidence. We need to be able to go into a clinic, go into a hospital, seeing a provider, and trust that we're getting the right information, that our interests are being looked after. How are you folks dealing with this right now, Dr. Durham, in terms of what we might describe as a crisis in confidence with regard to these policies?
Yeah, I think you're right that messaging around this is one of the biggest challenges. I think some of what we're doing is, you know, you can look at what isn't changing. Flu vaccine this year, the recommendations are the same, 6 months and up. Everyone should have an updated flu vaccine, and nothing's changed about that. That's a recommendation that's been there for years, and it's the same this year. So don't want to lose sight of the things that are solid. Same with RSV vaccine. Really, nothing has changed. I mean, RSV is a newer vaccine, but you know, if you are 75 and over and you haven't had an RSV vaccine yet, that's another really important winter respiratory virus to protect yourself against. That isn't an annual vaccine. That's just a one and done. And then people 50 to 74 with underlying conditions. There's also an RSV vaccine for newborns and infants that has really helped keep infants out of the hospital. So again, those things are solid. The FDA has approved them, the ACIP has approved them, the CDC has approved them, and we're rolling on giving them. So then that does leave us with COVID vaccine, which has been more confusing. And again, I'd say one of the biggest hurdles is that the CDC advisory committee just hasn't met yet on COVID vaccine. So they're meeting midweek next week, September 18th and 19th. And, I think if they release solid science-based recommendations, that will help. But in the meantime, what you see is states and public health departments and medical providers messaging the science-based guidance that we've had over the last few years, and that really hasn't changed. There's no new information that says that the COVID vaccine doesn't work or isn't safe. So I think really in the end, we have solid science behind the COVID vaccine, and we don't want to lose sight of that. I just want to make a plug again. The biggest risk group for bad outcomes from COVID are those 65 and over, and it's FDA approved for that group. That group really shouldn't delay, should move forward and get vaccinated.
Okay. Dr. Durham, what about the shingles vaccine? I'm in my 50s. I had chickenpox as a kid, like a lot of people. Are there concerns there with regard to the shingles vaccine and its availability?
Yeah, there should be, again, no changes to the shingles vaccine recommendation, and glad you brought it up. That's another great one, not a respiratory virus, but it has a reputation as leaving a pretty sore arm, but it really is super effective at preventing shingles. And again, shingles is when you get an outbreak of a painful rash, and it does stem from that, childhood chickenpox virus kind of reactivating. So it is a 2-shot series, and 50 and over, that should be on your list.
Okay. Well, like I mentioned earlier, it's been 5 years since the pandemic, and every year we do these COVID shows just to keep our listeners up to date. Of course, this shift in federal policy is really concerning for a lot of folks, so we definitely wanted to focus on that. But Dr. Durham, do you anticipate we're just going to be continuing to have booster shots and other concerns with regard to COVID in the years ahead? Is there any relief in sight, or is it really here to stay, like many projected when the pandemic first began 5 years ago?
Yeah, it is. I think the pattern we've seen is that it is a virus that mutates quickly. So we do have, I think we've all are keeping track less of which variant is out there, but it is a new variant. And so more than likely, we will continue on this pattern of having a seasonal vaccine. But I think, really what we want is to be able to follow the science on this. So we want to make sure that the scientific community continues to look at the vaccine and the virus and the effectiveness and whether it is the best solution. So right now, the science says, go get this season's version of the COVID vaccine. And, I think we all want to stay tuned and take it step by step on COVID, since it's still, in the grand scheme of things, it's still a relatively new player for us.
That is all the time we have for today's conversation. I'd like to say thank you to our guests, Dr. Miranda Durham, Janet Johnson, Dr. Beth Harp, and Dean Seneca. And please don't forget to join us again tomorrow for a closer look at 2 films with Native themes, one from Alaska and one focused on the history of Hawaii. I'm your host, Sean Spruce. You've been listening to the one, the only Native America Calling. Enjoy the rest of your day.
Skugtash. For more than 40 years, Ramona Farms has revived ancient traditional foods, tepary beans, pinoli, polentas, and more, all from store.ramonafarms.com. Ramona Farms supports this show. Omye.
Support by Sonosky Chambers Law, championing tribal sovereignty and Native American rights since 1976. From opioids litigation to treaty rights to tribal self-governance. With offices in Washington, D.C., New Mexico, California, and Alaska. Sonosky Chambers Law.
Support for this program is provided by AARP. AARP creates and connects people to unique tools and programs, helps conserve personal resources, and tackles the issues that matter most to individuals, families, and communities. What AARP does might surprise people. For more information and resources, including member benefits, AARP advocacy, and more, go to aarp.org.
Native America Calling is produced in the Annenberg National Native Voice Studios in Albuquerque, New Mexico by Koahnic Broadcast Corporation, a Native nonprofit media organization. Funding is provided by the Corporation for Public Broadcasting with support from the Public Radio Satellite Service. Music is by Brent Michael Davids. Native Voice One, the Native American Radio Network.